Thank you. Just an extension of that. I've noticed now that there's a push for New Zealanders to stay in New Zealand and move around New Zealand now that their overseas trips are being compromised. Is it a good idea that we encourage that?
Well, currently we know we've got 5 confirmed cases up in Auckland, and I don't think that we would be saying from a public health perspective at this stage, don't go to Auckland. Obviously, with the measles outbreak last year, there were some caveats about travel to Auckland, particularly for infants. But at this point in time, Peter, I don't think that we're saying no to any place in New Zealand. This can evolve rapidly, and I think that if we did begin to see community transmission established in parts of a city or in a township, I think that advice would go out. But at this stage, I don't believe that is something that a message that we're giving out to the public as we anticipate the holidays.
Thank you. Another question. I'm going to come over to this side of the room because we haven't had one over here yet.
Hi there. I've got 2 kids, 11 and 9, and they go to school and they play a lot of sport and they go to a lot of group gatherings, and I was just wondering kind of what's in place around schools or group activities, things like that. Is there any sort of process in place for dealing with children who might be affected or something like that? Anyway, thank you.
I'll just contribute a little bit on this, but the first people to ring are the Ministry of Education. So I'm answering because I worked there for several years, and they will have planning and support that will be going out to schools on this, that will be evidence-based and based on recommendations from the Ministry of Health in terms of how to respond. And so ideally schools are communicating really well with parents around their planning around this, and that those are consistent with your messages as a parent. But yeah, the Ministry of Education is the kind of main support there.
Just as a parent, I know that my children's school is actively kind of planning and communicating, and so they will have plans in place. For instance, if they need to close, which will be on the direction of the Ministry of Health, so they will all be planning. Some of them hopefully are communicating with their kind of parents in their community.
Katie, yes, I agree with what the Sarahs have just said, and I know the Ministry of Health has been working as part of the plan a cross-government approach, and so working with the education sector, and as has been said, planning is underway, same with my girls at both their schools. I imagine there'll be varying degrees of planning and communication, but as we go deeper into this event, schools will become a lot more explicit with their families about what contingencies they have in place. If a pandemic is declared by the WHO, then it does open up for nations, including ours as a nation state, legislation which enables the release of certain things. And so we can, if we were being quite draconian about it, with that legislation, open and close schools and do different things. But that would be done very, very carefully. It wouldn't be the first thing that we jump to. I know that, and my colleagues can respond to this in the literature, closure of schools or keeping schools open seems to have pros and cons. And so those kinds of discussions will necessarily happen. We have time on our side as more information is coming and as we see what other nations are doing to inform what actions that we will take.
Thank you.
Sorry, you asked for child questions, so looks like everyone's thought of one. It's much along the same lines. So I have a 7-year-old boy he comes back from school just the other day, I've got a stomachache, I think I've got the corona. This is what they're going to do. So obviously it's more about how I, as a parent, have that conversation with my child. Now obviously I know a little about viruses, so it might be okay for me to discuss viruses with my 7-year-old child. But not every parent can do that. So I feel there should be some kind of information that's quite simple to understand that parents can read and discuss with their children. Or, you know, kids like sticker charts that might not be carried from child to child, but they can identify when their parents are not washing their hands, you know, that kind of thing. You know, it happens, we don't always remember, we try our best, but I mean, I had a conversation with a co-worker today who doesn't wash his hands before eating food, and I said, why not? You know, you should be, you're an adult and you've got children, so for that kind of thing, it would be good to get the kids on board and maybe not freak them out every time something hurts.
Oh yeah, I would total what you say there in terms of emphasising what kids can do, what's within their control. Some kids will be really interested in this, and I don't think there's anything wrong with that. I know my daughter listened to a 36-minute interview with Kim Hill with a virologist, and she was 12, and I think as long as it's not accompanied by distress. So if you're noticing that they're really interested but they're actually quite distressed about it, maybe that's the time to distract. Make a plan about what to do, and then maybe not dwell on it and engage in other activities, and focus on reminding them about the systems we do have in place, about supporting people who are ill. I think there are a lot of jokes in school about the coronavirus. I mean, there's been plenty in our house.
Thank you. Now we have a good cluster of questionnaires in the middle here, so we'll come across.
For people that already have breathing problems, whether it's COPD, bronchitis, any of these things, you talk about having the flu injection. Would you suggest having the pneumonia one as well? Would that help, particularly older people like myself?
Yes, I mean, this is a time to reinforce all the messaging about the vaccines that we have, and certainly the Ministry of Health has got some very clear guidelines about those vaccines. And in adults, they tend to be optional, or they are optional. And so, this is the time we'll certainly reinforce those messaging, including the pneumonia vaccine as well.
So having both?
There's no problem with having both of those. Yes, absolutely.
Thank you.
Thank you. I just wondered if the flu vaccination is given, what the effect of that will be. Because last year, staff were encouraged to have the flu vaccination to prevent them getting the flu. So is it possible that this may be of some benefit?
So is your question about whether the influenza vaccine will help prevent this infection? We don't believe it will, but I think our main, in terms of the actual COVID disease, but in terms of the concern about having influenza around at the same time as this, that is the real concern. So that is the reason we're recommending it. I don't think we're expecting that the influenza vaccine will have any effect against this disease. It's quite a different virus.
David, is it possible that if we all change our behaviour because of the COVID virus, we will reduce the spread of influenza?
Well, I think what will happen is there will probably be almost certainly an increased uptake of the vaccine this year, so probably you're almost certainly right.
Question here.
Thank you. Good evening. My question is, how do we know it's not already in the community? So, for example, we've had quite a few sniffles and fevers and things at work. We had somebody who went on a cruise over Christmas and got sick and has been back and forward since then to work. How do we know it's not already here?
Sorry.
I mean, what's happened in a lot of comparable places is that the signal is generally you get people turning up with unexplained pneumonias in hospitals, particularly in ICU units. So we're alert to that and we're keeping a close eye. We've spoken to all our frontline doctors in the hospitals and that sort of thing. So I think people are pretty alert to that. Travel history is a very important part of the assessment as people come into the hospital setting. And contact with travellers is another thing we might ask in people who have these symptoms. So I think that message has really got out there, and I think in primary care as well. Ben may be able to say more, but I'm pretty sure that message is pretty out there. So I think the surveillance system's never perfect, but I think we've got a pretty good chance of picking this up early.
Comment, Ben?
Yeah, certainly for the last I don't know how many weeks, there's been a lot of messaging to primary care about the importance of travel history and patients presenting with those sort of symptoms. So, yeah, as Josh says, there's no perfect solution to this, but I think we've put the gate as tight shut as we can.
Good to know, because I'm a people leader and I've got people already talking about self-isolating and planning their next fortnight, so nice to know.
I just want to pick up on the sniffles, because that's not how this virus presents. So the sniffles to me means a head cold, so runny nose, blocked nose, and the minority of patients with COVID-19 have that as a symptom. It's really lower respiratory tract symptoms that we're worried about, cough and breathing difficulties.
Thank you.
Right, another question over here. We're going great on the questions and we've still got plenty of time, so keep them coming.
So if somebody goes into isolation and they need food, do you just open the door a little bit and poke it in?
Sounds like my household.
If they've got a cat door, that's another way. Actually, we may laugh, but that's a very practical question.
Yeah.
I haven't done it myself, but I think the advice we've been giving is you can leave the food outside and let the person know, phone them and say, there's food at your door, and they can go and take that food and go in, so there's no contact. But I don't know if any other members of the panel got.
I think the Uber Eats delivery teams at Wuhan had this completely sorted. They were doing deliveries in PPE and kind of leaving it with a kind of a several metre gap between the deliverer and the recipient. So some sort of social distancing. I think we think about distances of at least 1.5 to 2 metres between people who might be potentially infectious and other people.
Thank you. Question down here.
You mentioned about self-isolation. I was wondering whether you could just expand on what people should have in mind should we find ourselves in this position where we should be self-isolating, apart from perhaps fighting in the supermarket over toilet paper.
It involves a whole heap of practicalities. So you need supplies in terms of how you're going to manage at home in terms of food and other kind of household supplies. So I think people having some extra items at home without the complete panic buying, clear the supermarket shelf. About 2 weeks ago, my husband saw someone with an entire trolley full of flour, and I don't quite know what he was planning on doing with it. But it's more than that. It's you might be asked to self-isolate even though you're actually completely well. Can you work from home? How are you going to manage your employment? How are you going to get that kind of social gratification that we all need? It's actually incredibly boring being on your own. So what's your social network and how can you connect with them in other ways? Because there are some mental health impacts of that social isolation and social deprivation. So it's having some thoughts and plans for how you might kind of have some purpose in your life and some activities that keep you sane for those 2 weeks.
Can I just add to that? I'm just particularly mindful of families with children with disabilities in this particular scenario, in that, first of all, some children will be might be more vulnerable in terms of hand washing and some limitations that they might have, but also the families in these situations. And I think that as a community, I think we're really, really good at supporting each other, and people do pull together when communities are under stress. And so being really mindful of people who might need extra support and extra help, and families and other people with disabilities as well.
And I've heard some of my colleagues say, oh good, there's a few Netflix movies I can catch up on. But I think that point too is that there are, you know, for our Māori, Pacific and low socioeconomic communities, there are some significant challenges, and the digital barriers that they have is just another addition to challenges of isolating yourself for 14 days. And so this does come back to how we as a community identify those who may be challenged or live next door, and the little things done together as a community. We talk about the hand hygiene things, but also the supporting of those that we know. We've heard about someone's parents, their elderly parents. There are going to be families who also have other needs. And it's really important that in an event like this, that kindness is the attitude with which we approach it. We know the challenges of racist and xenophobic statements that are being made, either verbally or on different electronic platforms. Those things are not helpful. And so it is up to us, individually and collectively, to do what we know is right. And so those things of kindness, those things of giving, those things that we know are a challenge for some of the families that we may know close to us or in other parts of the city, how we respond to them can be critical in a situation like this.
Thanks, Wayne. So yeah, I'm going over there and I'll come back to you.
I'd just like to know, everyone talk about self-isolation and all of this, and we all get that to cut down on the spread of the virus. Is there any recommendation out for employers or frontline staff who's been told to self-isolate, and how the remuneration work? Is there any systems in place for those people who now not by choice want to take annual leave, for example, or sick leave? Is there any compensation for those employees who has to then self-isolate for various reasons, being in contact with potential people who might have those infections? What is your advice?
Shall I take that, Peter?
Yeah, can I just, before you do, can I just, and thank you for doing it. Can I just say that the Canterbury Employers Chamber of Commerce, and I was the ex-chief executive of the Chamber, have published today a very, very comprehensive, on their website, very comprehensive question and answer. Do I have to pay my employees? What do I do if they self-isolate? All those questions are addressed on their website. So CECC, Chamber.
I don't need to say anything. Hi, Peter Fett. I'm an occupational health and safety advisor. So we've been working on this sort of thing since December, putting in plans for ourselves and other people. The Ministry of Social Development and MBIE have really good resources already there. You've got to go through and look for them, but if you go in there, it does tell you what is available. It's not great. It basically says that it's up to individual employers to have their own plan, but where somebody loses their job as a result, then the Ministry will step in to assist. And some of those wait periods that were there before have this week been dropped. So support should be available quicker.
Anything the panel would like to add to that? No? There has been some discussion, you may recall that in the earthquakes that there was an employer support subsidy that was introduced to businesses that ran out of cash because they couldn't do their business, which was extremely successful in a post-earthquake environment. And there's certainly been some lobbying from the Chamber and from Business New Zealand to introduce that on a selective basis if it's required, because it's a really good way of maintaining employment relationships and saving businesses. Question over here.
In the Latin dance scene, there are in the coming weeks and months, I know there are many events planned that involve between tens and hundreds of people getting together, including some international artists that are coming to New Zealand. In those events, in classes and parties, everybody dances with everybody in close embrace. It's not exactly the definition of social distancing. Those events often are not run for profit, so tickets are very expensive, but refunds are very unlikely because the expenses have already been incurred. And therefore, I think people are psychologically motivated to ignore small risks like a slight cough and go anyway. So my question would be, in your professional opinion, a rational person who is not panicking at this point, would they be wise to just say, okay, I'm just sink my costs, I paid for the ticket, I'm not going to get it back, but I'm not going to this event? Or are we not there yet? Because there's, on one hand, we're saying, oh, there's only 5 cases in New Zealand. On the other hand, we're saying there's probably already community transmission, but it's not being tested until the serious cases get to hospital, in which case it will be too late because there's already a lot of people infected. So do we do that? And those events, they're not likely to be cancelled unless there is a very clear directive from the Ministry of Health that says it's not allowed to do that anymore. So where are we at this point on that?
Well, I think you have answered your question. We're not at that point. But of course, all of the things you've articulated are being thought about right now. And locally, we have an Easter camp that occurs every year. 3,000 odd young people go to that. That's a month away. Do we cancel that or do we not cancel that? I don't know the answer to that question. But the discussion is happening. And I'm trusting that my colleagues and the technical advisory groups and what we're currently seeing with only the 5 cases, and knowing, as Josh has described, the transmission of the virus, putting all of those things together, I think it's important to make haste slowly on these things, but I think that it will be timely if and when that advice does come out.